Again, welcome back, everybody. Time for one more interview. As we've been saying this morning, that the World Health Organization believes the reopening of schools and even economies should be revisited. The president of the South African Medical Research Council, Professor Glenda, joins us now for a response to SADTU and also just generally talking about the COVID situation in South Africa. Professor Gray is also a member of the Ministerial Advisory Committee on COVID-19. Prof, what a pleasure to have you. Thanks very much for being with us.
Thank you very much. I'm also a pediatrician and a mother whose child is going to school.
Well, there you go. So that makes it even better to speak to you, because this is coming from a place of your heart as well as of science. So what do you make of this? I mean, we are seeing calls for schools to close because it is a big risk. Where do you stand on this?
But I'd like to understand further what the issues are and what their concerns are. So I guess there's a breakdown in communication. We do know that children are less likely to be affected by COVID-19 than adults. And if we look at the 13 million infections and 500,000 deaths, very few have happened to children. Both in South Africa and at the global level, death in children is a rare event.
So we talk about the deaths of children, but let's also look at the health of teachers, because I think, we obviously are focused a lot on the children, but it's the teachers that would be at risk as well. So their risk factor?
I think it's important for us to understand the profile of our teachers. How many are over 55? How many are obese? How many have hypertension? How many have diabetes? How many are HIV infected? And once we know the profile of our teachers, we can then make a risk assessment about who should be teaching and who should be supporting teaching. And we also need to understand how you transmit it. And we know that adults are more likely to transmit it to adults. And so teachers need to make sure that they are practicing NPI in the classroom as well in the tea room. So you can't take your mask off, have tea and be close to your fellow teachers, because it may be that teachers are transmitting to teachers in these situations.
But as much as you'll find that people are trying to follow these rules to the T, it's still spreading, and you're still getting instances where there are teachers that are getting infected. And even, particularly in high schools, you find that the older learners are getting it, whether it be grade 12, grade 11, then their entire class has to shut down and everybody has to quarantine. And it's very disruptive for the schooling environment. I mean, surely the mental issues are something that need to be taken into consideration too.
Yeah, it's very disruptive, I agree. And as we get better at managing COVID in the classroom and understanding the transmission events, it'll become easier to manage these disruptions. What's worse is not having children in school. We have children are born every year. They all grow and they all have to go into school. And so every year, every month that we disrupt has a knock-on effect from grade 1 to university. And so we have to find ways of teaching our children. We have to catch up the school year. We have to be innovative in what we do. And we have to try and balance the coronavirus with schooling and understand what puts people at risk and what doesn't. Ventilation, congestion, you need to open up windows, children need to be spaced, you need to avoid crowds, and teachers need to teach in a way that doesn't put them or their pupils at risk.
So let's look at it this way. One of the things that SADTU is asking for, and they're not the only union, because they were in support, and now because of what they're seeing and some of the evidence that they're getting is suggesting that we should shut the schools until the peak is over. Now I want to talk about this peak because, I need to understand this a little bit more. Will that help? I mean, if we perhaps shut now, wait for the summer months to come, and then try and start catching up. Let's talk about that scenario.
But I think we're not too sure when this peak will ever end. We know that this coronavirus is going to be around for the 2 or 3 seasons. So until we have a vaccine, it's going to be hard to know when the peak ends. We look at the US, just when we thought they were out of the peak, they've actually gone higher and higher. And so it's hard to understand how, in the Western Cape, we opened up the schools in the middle of the peak, and maybe we need to learn what went wrong, what went right with opening up schools in the middle of the peak in the Western Cape. So I think that we have to try and understand the concerns of the teachers, of the parents, and of the scholars, and try and make sure that we empower them to protect themselves and be able to learn at the same time. So it's all about knowledge and communication. It's all about being empowered to know how to protect yourself, your classroom, and your family.
You know, one of the things that I've been wondering personally is that let's say, for instance, that a decision is taken that we're going to close schools now and pick it up at a later stage. Are we just postponing the inevitable? Are we kicking that can down the road, that no matter what we do, it is going to spread and this is going to happen? We're just delaying it.
Well, everywhere we look, the epidemic is out of control. So it's since December last year that we've seen this epidemic take control. And at this moment in time, 13 million people globally have got it. And so the evidence that we can contain it and have low community transmission, I think there's little evidence at this moment. I think that community transmission is out of control. And what we have to do is try and minimize our elderly, our vulnerable, and people with comorbidities getting coronavirus from others. And so we know who are the most vulnerable. We know how to protect them, and we know what we have to do. And we have to try and teach our children under these conditions because we don't know when it's going to get better.
Yeah, so that's something that we all need to keep in the back of our minds. But it's still a great worry when you're playing in the unknown. You almost feel like you're a bit of a scientific experiment. Are we? In all honesty, are we?
We have evidence. We have evidence in children at a global level. 13 million people who've had coronavirus, and we know how little it has affected children. And so we do have evidence both locally and globally that our children are not affected as much as elderly people and people with comorbidities. And so that is evidence from 13 million people. You can't get better than that. And we have to now try and find ways of protecting people in the classroom, our teachers, and making sure that the teachers who are elderly and have comorbidities are not direct frontline teachers, but are supporting those that are teaching. To close down schools when we know that most infections are asymptomatic, and most people who have the virus may not even know they have it. And so if we have to close down schools, it's like closing down society.
But if you look around the world, there are a lot of schools in many countries in the world that never took this risk, that kept their schools closed. They just didn't want to even try and kick off that schooling year. Some countries, like, for instance, Kenya, I know we give it as an example because that is here with us on the African continent, have said, we're suspending the academic year. They don't want to take the risk. And yet, we went ahead and did it.
But I think we're a low middle income country, and we look at other societies that have opened up schools. France put 1.4 million children back into school, and only 70 children got infected. And so I think we have to learn, what did they do well that we must learn. And so I think that we have biological plausibility that children will not be as susceptible as to morbidity and mortality as adults, and we need to use that. We know what we have to do. We have to implement non-pharmaceutical interventions, and so we have to protect everybody in society as they go about their work. This virus is going to be with us for a long time, and without a vaccine, we may have to keep our children at home for over 6 months to a year. What are we going to do about next year's children? What about the grade ones that come in next year? What about the people who have to go to matric? And what about our university students? And so we know that young children under 20, are going to be mostly asymptomatic and have very little side effects. And so keeping these children out of school is keeping them away from a meal, keeping them away from open areas, and also affecting their mental health and their emotional stability.
It's a very, very difficult situation, and I get what you're saying, but I can also understand how concerned a lot of other people are about this. But I want to move quickly away from the schooling issue, and I want to look at the taxis, though, because that's also a big problem. 100% capacity that was announced. You've got so many people packed into a taxi, and I know they're saying keep the windows open, but in this cold weather, it doesn't seem realistic. I mean, isn't that a worry for you, the spreading like that?
Of course, everything that's in a congested area is going to be a worry for me. And if you are in a congested area or in a crowded area, you have to make sure that the windows are open, that there's ventilation. These face shields that are about 20 Rand at the chemist are incredibly important in very crowded places. Washing your hands, being being religious about sanitizing, making sure you're not touching surfaces, and trying to make sure that you stay as little time in a taxi as possible. 100% occupancy is not the ideal situation, and we have to try and understand why the government made that recommendation, and to try and speak to the taxi bosses and the government about protecting both their drivers and their conductors and their passengers. It doesn't help us if our taxi drivers also are getting COVID because of a congested taxi. So it's about saving and making sure our taxi drivers are safe, their conductors and the taxi passengers, because everybody is important, and the taxi bosses and the taxi industry has to understand that we have to protect everybody, and try and find ways of minimizing transmission in taxis. And so they need to understand the dynamics of transmission in taxis.
And this is the problem. And there's a comment that your colleague, Professor Karim, made. I think he was, I don't know where he was speaking, but it was quite recently. And what he was saying was that that COVID-19 could cost more lives if scientists bow to political pressure. It's science versus politics. And this is my concern, is the political pressure versus the science. How are we doing? Who's winning the battle?
I think it's important for us as scientists to keep on telling how you can increase the transmission. And we do know congested areas will put people at risk. And so we have to say to both the taxi industry, to our government, and to our taxi drivers, is that they all have to take care of themselves and try and understand why this compromise was made to have congested taxis in short distances. And so we need to try and understand further that although there may have been compelling pressure, this may not have been the best approach for the health of our citizens.
Finally, as I wrap with you, I wish I had more time, but our previous guest from the NICD alluded to the fact that there honestly is really no evidence that smoking compounds the risk of contracting the virus. We all know smoking's bad for you. We know that. I was born knowing that. But what reasoning are you using as the National Command Council to keep this ban in place? We got FITA back in court today. What is the reasoning?
The MAC did not make any decisions around tobacco control. We know that tobacco control is a huge problem. We know people can get cigarettes on the black market. And so I think I agree with most of my scientist colleagues, is that the ban on tobacco is not helping the country's economy, and people are still getting cigarettes. So it seems a bit futile to ban cigarettes when I look around and everybody is still smoking.
If I want to have coffee with you one day, maybe we can bring our kids for a play. How old is your kid?
My youngest is 17.
Okay. Well, good luck. Obviously writing grade 12 in matric at this point.
He's in grade 11. He's just started the year now.
Yeah.
Again.
It's a tough time. It's a tough time. Doesn't matter where you are. It is a tough time. But listen, thanks for your time. We'll invite you again when we've got more time. The president of the South African Medical Research Council, Professor Glenda Gray, giving us her views on coronavirus and more. Let's take a break. We'll see you after this.